10 signs if you have cancer in your body. Every sixth death in the world is due to cancer. About 10 million people die from cancer every year. It is the cause of every sixth death. It is one of the largest health problems in the world. But the good news is that there are things you can do to catch cancer early when it's easiest to treat. First, keep up to date with your cancer screenings. Second, pay attention to how your body looks and feels and be on the lookout for changes. The symptoms of cancer can be vague and can be linked to other illnesses or health problems. There are similarities. Talk to your doctor if you see or feel any of the following. Number 1, mass, lump. If you see or feel a new lump that has been there or has been growing over the past few weeks, get it checked out. Many lumps are not cancer and your doctor may be able to tell you right away. Perhaps an ultrasound, CT scan, or MRI, unexplained weight loss. Most adults cannot lose weight without effort. Therefore, if you are losing weight without participating in a diet or exercise program, talk to your doctor. Unexplained weight loss of 10 pounds or more may be a sign of cancer. Cancer of the stomach, liver, and pancreas can cause loss of appetite. Colon cancer prevents the colon from properly absorbing food and nutrients, leading to weight loss. Other cancers can cause mild nausea, which may mean you eat less. However, weight loss is not always a sign of cancer. You may be losing your appetite or skipping meals for reasons such as stress or depression. Pain. Don't ignore pain. If you have new and ongoing discomfort, get it checked out. But remember, many cancers do not hurt. So if the lump hasn't gone away, get tested even if you don't feel pain. Most breast cancers are not painful and a growing mass that's not painful is concerning. 4. Changes in bowel or bladder habits. This can mean blood in the urine or stool or changes in the stool. For example, your stool may be pencil thin or black. Any of these could be signs of colon cancer. For men, urinating more frequently can be a sign of prostate cancer, as it can mean that the bladder is not completely empty. Difficulty urinating can also be a sign of prostate cancer. However, this is often due to another less serious condition. For women, more frequent urination may be a sign of gynecologic cancer unless they are pregnant or drinking more water. Take note if you also feel full, have abdominal pain, and experience bloating. Not every urinary symptom is cancer, but if you are concerned or a problem is persistent after treatment, talk to your doctor or seek a second opinion. Fatigue. It's not just about being tired after a busy day. Ask yourself, is my fatigue limiting my activities? If you seem well rested but can't get out of bed and go to work or do something fun with your friends, that's the problem. However, fatigue is not the main symptom of cancer because there are many other disorders that cause fatigue. Please consult your doctor. A sore that doesn't heal, it doesn't matter where it is. If you have a sore that doesn't heal, it should be checked out. Ulcers on the nipple can be a sign of breast cancer. And of course, sores on the skin that don't heal can be a sign of skin cancer. In the mouth, the sore may appear as whiter areas that cannot be scraped off or redder areas that cannot be removed. Both can be signs of oral cancer. Talk to your dentist about oral cancer screening. The dentist can also look for changes in color or run a finger around the mouth to look for lumps. Change in a mole or wart or any skin change. Everyone should be aware of how their moles, freckles, and warts look. That way, if anything changes, you can tell your doctor. You can use the ABC guide to track changes in your molds. People at higher risk for skin cancer should have annual full-body skin cancer screening by a dermatologist. This includes people with fair skin and red hair, people with more than 50 molds, and people who have been exposed to the sun or tanning beds for too long. Annual screening is also recommended if you have a family history of melanoma or a history of skin cancer. Here is a full list of who is at higher risk of skin cancer. Unusual bleeding or discharge. Seeing fluids where you don't normally see them can be a sign of cancer. If you are a woman, this could be vaginal bleeding or discharge different from what is normal for you. It could also be bloody discharge for nipple. Indigestion or trouble swallowing. There are some benign throat conditions that can cause problems with swallowing, but indigestion or trouble swallowing also can be a sign of esophageal cancer. If you are having trouble swallowing, perhaps with pills or meat, talk to your doctor. If you've been having indigestion as well, that makes it more of a concern. Number 10. Nagging, cough, or hoarseness. A persistent cough or hoarseness may indicate the presence of lung cancer, while a hoarse voice could also signal a tumor near the vocal cords. Lung cancer is the deadliest among all cancer types, underscoring the importance of recognizing these symptoms, particularly if you are a smoker. Physicians often observe these symptoms for several weeks to monitor any changes. Even if your symptoms seem mild, it is crucial to promptly seek advice from your doctor. Always remember that any persistent symptom warrants evaluation and follow-up. This concludes our discussion of 10 potential indicators of cancer in your body. We appreciate your viewership. Please consider liking and subscribing to our channel.